Yeah. All right. Stand by. We are inside a minute here. I've enjoyed this morning. It's been great working with you.
10 seconds.
Here we go. 11:60 a.m. KBDT News Talk Sports. Welcome to JP, Kathy, and the crew. But actually, there's no JP. It's JD. And there's no Kathy. It's Dr. Rebecca Good. And the crew, however, is as ephemeral as the grass. They're right here with us. And so are you. Welcome to 11:60 a.m. KBDT News Talk Sports. We're looking for a windy, hot, and humid day today. I tell you what, it was a real adventure driving home because there was so much wind. I was driving my Tahoe, getting jostled around. It was kind of fun. I actually enjoyed it. But if you enjoy that kind of thing, you're going to have it again today. Expect the high to be somewhere near 96 degrees. Going to be muggy too, mild tonight, low 78. 82 right this very moment. On JP, Kathy, and the crew at 11:60 a.m. KBDT News Talk Sports. It's 8:35. You got to be there by 9 o'clock. You have exactly 23 minutes and 47 seconds to get it done. Joining us is Steve Dunn and the lovely Patty Giola.
Good morning.
And they are with the Mental Health Moment, sponsored by Acadia Healthcare. And welcome to you, and good to have you here.
Good morning. Good to be here, as always, every Tuesday.
I just don't understand why you don't refer to me as the lovely Stephen Dunn.
That is as
sexist.
obvious as can possibly
That is sexist.
be. It is
It's a male-centric
yes.
statement.
It is a male-centric. We were just discussing that. It's the Western civilization and an ability to not notice the beauty of most men. Speaking of beauty, we have a guest. Would you like to introduce said same?
Yes, I am very excited. Lisa is a guest. She's a friend. She's been on our show before. And for a lot of our listeners, she might not need an introduction, but I'm going to ask her to give us a little bit of her background anyway. Tell us what organization you're with and some of your...
Elissa Myers, right?
Elissa Myers, yes, Elissa.
Cool.
Well, hey, Patty, Steve, and JD, it's great to be with you. I'm very honored to be back on the show. For the past 5.5 years, I've had the privilege of serving as the Chief Staff Executive for the Academy of Eating Disorders, the leading global professional society of physicians, psychologists, psychiatrists, nutritionists, and academic researchers, and others working to understand and address a terrible, terrible mental health condition called an eating disorder around the world. And I'm a lifelong advocate of the power of collective action.
There you go. That's important. Lisa, talk to us about what the reason is that we've invited you to join us today, which is the Deloitte Report. Tell us a little bit about the background of that and what announcements that's going to bring to this community.
Thank you so much for giving me an opportunity to talk about this. I feel so passionately about the importance of what has just been published. Everything in life is governed to a great extent by economic choices, whether we recognize it or not. And what gets treated in healthcare, what gets researched in healthcare, comes down to somebody making a decision based on data about what the most important healthcare choices are. In 2012, an organization called the Butterfly Foundation wanted to leverage the power of economic data, and they commissioned Deloitte to examine the economic and social costs of eating disorders in Australia. And what they found was stunning, was greatly underestimated by society. And as a result of the data that they were able to generate in that study, they had literally more than $100 million in funding dedicated from the Australian government to increase research around and treatment of eating disorders. I was so impressed by what they were able to accomplish that I've been fighting for the last couple of years to see a similar report commissioned in the United States. And we got very lucky thanks to the tremendous support from the Stripes Foundation, the Strategic Training Initiative for the Prevention of Eating Disorders out of Harvard T.H. Chan School of Public Health and the Academy where I work. And we commissioned Deloitte to do a similar study in the United States. We've just released a report revealing that eating disorders cost the economy nearly $65 billion, with a B, billion dollars in fiscal year 2018-19, the focus year of the study.
Okay, so let's break that down a little bit. What exactly do you mean when you say it costs the U.S. economy $65 billion a year? How was that number reached, and what all does it encompass?
You know, it encompasses a variety of complex factors. It encompasses, for example, productivity loss. So employees who are suffering from eating disorders and the members of their family are often unable to report consistently to work. They have high turnover on the job, and they have high absences and costs. So for an employer, it costs employers approximately $16 billion with a B. Government does provide funding through CMS and other services for those individuals obtaining medical coverage through the government. Costs another $17 billion. There were, in the year that we looked at, there were 53,918 visits to the emergency room. And if you've been to a hospital lately, you know that it is not inexpensive to make a visit to the emergency room. You've got all kinds of expenses, especially in an era where the number of hospital beds, the number of personnel is so uber challenged by this horrible pandemic that we're all facing and fighting.
Lisa, a lot of people don't think that this is really a very big event, that it's not so prevalent and that a very small percentage of people are impacted. Is that true?
It's not true. The truth is that at some point, 9% of the U.S. population during their lifetime will experience a serious eating disorder. And the number, I'll tell you a sad story, Patty. A very good friend of mine, one of our members, and a passionate, wonderful, hardworking advocate, lost a daughter day before yesterday to suicide after a more than 10-year struggle with an eating disorder. There are 10,200 deaths every year. 10,000 deaths a year. Okay, it's not 125,000 people dying of COVID in a year, but it's 10,000 deaths year after year after year after year. Somebody dies every 52 minutes. So yes, ma'am, I'm sorry, but it's an extremely important medical condition that is woefully, tragically, too invisible, too under-recognized by both our policymakers, our medical professionals, and the public at large.
And in fact, I think the report went into the 28.8 million Americans alone will fight an eating disorder sometime in their life. Is that correct?
That is correct, Steve. In fact, it's 28.8, so it's almost 29 million Americans that will have an eating disorder in their lifetime.
And then just in the past year alone, between 2018 and 2019, that number was 5.48 million. Is that correct?
Yes, sir. You've done your homework. Good job. Yes, sir, it is.
Lisa, one of the things we're talking about is the high cost of dealing with these mental health issues, specifically eating disorders. Talk a little bit about the Partnership for Prevention. What could we do to address some of those costs by proactively attacking this issue?
We're excited about this study because we feel like we now have the groundbreaking economic argument to defend investing in preventive research. Prior to this position, I had the privilege of serving as the president and CEO of a group called the Partnership for Prevention. And we did minuscule, very tiny, narrow, deep, and very many studies on preventive medicine. What happens if you put a soda tap on soda, to the consumption of soda. The biggest progress was made around tobacco. You know, everybody knows, smoking, you shouldn't smoke. But when you can demonstrate that through very specific preventive measures, including the increasing cost of tobacco and the, you know, when I was growing up, I could walk up as a 13-year-old to the counter in a drugstore and buy a pack of cigarettes. Shocking. And today, of course, even if you're 65 years old, they card you to make sure you're old enough to buy your tobacco. That's a preventive measure. And there are many, many things that can be done in society that will prevent the triggering of what is often a genetically wired condition. There are many, many factors that trigger an eating disorder. Trauma is a major factor, and there is a huge genetic component. But there are things that can be done that prevent it. For example, bullying and weight stigma is a huge trigger. And there are things we can do within our school systems and within society that show respect for health at any size. There are other factors, the photoshopping that you see in a lot of fashion magazines, where everybody always looks fabulous. I wish I looked as good as every model in a photo magazine looks, because they are so often photoshopped. But I would say that the biggest preventive measure is early diagnosis and early treatment. And to do that as a preventive measure, we have to improve the education of healthcare professionals around eating disorders. Many healthcare professionals, doctors, nurses, have told me that they had virtually no exposure or training to the subject of eating disorders in school. And this is not a choice. It's not something that you do let me stop eating, or let me eat everything I want and then just because I can, and then purge myself. This is not a choice, but it gets triggered by the society around us.
Elissa, the report then also goes into something called the cost effectiveness of best practices and intervention. What exactly does that mean?
So again, it means several things, Steve. That's a complex question. It means several things, but if we had better outcomes data, and again, I want to emphasize this report, as excited as I am and as important as it is a foundational beginning. It lays the path for a great deal more research that needs to be done. But one of the things that phrase that you just used refers to is in creating an evidence base around what forms of treatment work and what don't. In an extreme case, often somebody will present at a emergency room. They're dying because they are so severely so malnourished and underfed and undernutrition for so long and the doctors will bring them in, they'll hospitalize them, and they will refeed them, and in a week the patient will have regained some magic threshold of weight, and they'll be discharged. And nothing has been done to treat the underlying condition of the mental health problem that they're struggling with. So the net effect of that is that, like a yo-yo, in 2 months, 3 months, 6 months down the road, they're back in the emergency room, and it goes on and on. And the cost of that to society, to the hospital systems, to the families of these people is enormous, and often results, sadly, in a fatality.
So
that's one thing. Yes, ma'am, go ahead.
So one of the things that you're saying is that they're back in the hospital in a very short window of time, and we know this to be, sadly, very true. What is a first step to do in that arena? What would be the first recommendation that you would make, or your colleagues and professionals would make?
Well, the first step is training the emergency room personnel to understand what they're seeing and to address it. We've just published a new publication for emergency room personnel to help them identify an eating disorder when that's what they're looking at.
That's going to be critical to push that out. We are going to be able to help you with that.
You're listening to the Mental Health Moment. This is 1160 AM KBDT News Talk Sports, a regular weekly feature of JP, Kathy, and the crew every Tuesday, Mental Health Moment. And we thought about doing it on Monday, but no, that's not the right thing to do, because Monday it's Fire Put Out Monday. And so what we wanted to do is we figured that once all the fires are put out, then we can actually start thinking about how to keep them from bursting into flames next week. That's why we do it on Tuesday. That's what the press release says, and I'm sticking to it. John David Wells, Dr. Rebecca Good, Stephen Dunn, and Patty Giula. The Mental Health Moment, back with more in just a moment. What? You can speak.
Is it 10 seconds up now?
Yeah.
No, you don't have to wait 10 seconds. I mean, go ahead, what?
I do, just out of my respect for you.
What?
I don't.
I'm sorry, what? It sounded like you said you had some respect for me.
That's a foreign concept.
It is a very foreign concept.
My nose just grew. Okay, Lisa,
Yeah.
we are up on Facebook Live, so I'd like to continue the
Get closer to your microphone.
conversation.
Get closer to your microphone.
How's that, Dad?
Butter,
Okay.
better.
Perfect.
Closer to
Elissa,
your microphone.
dead air. In the treatment of eating disorders, we know that there is evidence that early diagnosis and treatment is more effective, more cost-effective than the treatment for a condition that is allowed to linger. You gave a great analogy about our cars. Can you go into that and explain a little bit why we have got to be more proactive and preventive, and what exactly that means and does?
Well, it's kind of a strange analogy, but I read a study that said that the older a car is, the more the car is going to cost to maintain. So a 3-year-old car is going to cost you $83 a year in ongoing care costs. A 5-year-old car costs $200, and a 10-year-old costs $458. Well, it's kind of a silly analogy, but in the treatment of an eating disorder, there is specific evidence that early diagnosis and treatment is more cost-effective than the treatment of a condition that's allowed to linger. So often, if it's diagnosed very early, you can get into a peer support group. People are different. They present with different symptoms, and there are different structural conditions and underlying conditions that are both physical and mental that are informing their mental condition. But what is clear is that the earlier they can be treated, the less expensive the measures are to treat them. So cost effectiveness of step care and integrated care. Step care is an evidence-based system that, to use a simple analogy, if you have a minor paper cut, you can put a little antiseptic cleansing, some over-the-counter Neosporin, and a Band-Aid. And for most people, that will be sufficient. But let's say you have a history of developing serious infections, or let's say that you got the cut in a toxic environment. If you do, you may need some more elaborate antibiotic and the monitoring by a healthcare professional, and that's more expensive.
1 minute.
So the sooner, the quicker you can get to notice that there's something going on, the sooner you begin to treat it, the less expensive it will be to treat, as a general rule, in the long run.
Okay, so we only have about 45 seconds left before
About
we go
30 seconds, but who's counting?
Okay, before we go on air, so when we come back, we want to emphasize, what are the next steps after this report? What direction you plan to take this? How impactful that will be? And, what hope can we give to the families and people who are suffering from this disease right now?
Great.
Please stand by.
Can she sit by as well?
No, she has to stand by.
Stand up, Lisa.
That's why we have Veridesk. 10 seconds. That's why we have Veridesk. Shh. You're listening to JP, Kathy, and the crew. This is 1160 AM KBDT News Talk Sports. If you've got to be there by 9 o'clock, you have exactly 5 minutes and 45 seconds to get that done. So drive carefully as you do that. This is the mental health moment. We all have things in our heads that are driving us nuts. All of us do. And when I say driving you nuts, I'm talking about the colloquial term. I mean, these are things that, strangely enough, can actually be taken care of quite simply. Do not suffer another moment. Call Chris Getz, our buddy at Acadia Healthcare, 469-400-7499. She's standing by right this moment. Proud sponsor of the Mental Health Moment with Patty Giola and, of course, Steve Dunn. And our guest today is Elissa Myers. And we have just a few more minutes, and we've got to talk a little bit about this Deloitte report that we've been dealing with regarding eating disorders. And there's some important stuff from a standpoint of moving forward.
So, yes, as we ended up through the Facebook break there, Lisa, we want to be sure that we're getting what are the next steps in a go-forward world?
Well, the next steps are to define a research agenda around this and prioritize the research steps. We need more research. We need desperately, and before I die, I want to see this happen. Not that I'm going anywhere anytime soon.
Rush that
one. A while. But we need a national outcomes database so that when people are treated, we know how they were treated and we know what the results of that treatment were, and we knew what the underlying conditions were. We need this desperately. Some of the mental health sectors have begun to develop it. The American Psychological Association has a pretty powerful outcomes database that they're building, but we need that in the field of eating disorders. We need more research on specific outcome performance by very specific, narrowly defined prevention measures. For example, one of the things that we advocate for strongly is putting diet pills and laxatives and diuretics, those kinds of things, behind the counter. They're very dangerous. I won't name specific brands, but there are some very dangerous brands out there. We're working with some of these great companies that address obesity to help them understand the relationship and the triggers they may be unintentionally setting off in their customer base, and to help them think better about that. So we need more research to demonstrate. So research and the research agenda is a very big step. But in addition to that, we need to collaborate and build a worldwide community better. We need to be in discussion with major associations representing other sectors in the healthcare community. And one of the things I'm looking forward to participating in the year ahead will be discussions with groups like the National School Counselors Association, with the Obesity Society, not because we want to support what they're doing, but because we want to talk to them, better understand where they're coming from, but more importantly, help them understand the relationship of what they are doing and teaching and researching to the world of eating disorders.
Elissa, so how does that lead to eventually coming up with generally accepted treatment guidelines, which we don't have now? But shouldn't that also be an end goal? So a person who's receiving treatment in Texas can go to California or New York and basically have the same basic type of treatment that's given to them.
Yes, so all scientific progress really begins with an observational hypothesis. So you look around and think what's working. And what we have done this past year is develop taken three different looks at what may help to prevent and what may be effective treatment measures. We've done that through three different documents that we've created. But now what we need to do is test the assumptions in each of those documents and monetize their, and it's coming. We're getting there. We're going to do this.
Elissa, there's so much more that we should have talked about today. I would like to invite you to come back and talk about the national outcomes database you'd like to see. So don't go dying on us yet, okay? We need you.
No dying.
I'm so honored to be with you guys. I think you're pretty spectacular. All three of you, all four of you.
Well, that's very nice of you, and so on and so forth. But you need to remember something here. I'm the general manager of this radio station, and what we're talking about, you're talking about something that's against company policy. I'm going to have to do a counseling for him, so stay here. Don't go anywhere, and we'll be talking more about that coming up a little bit later on. If you're on Facebook right now, JP, Kathy, and the crew, then stick around because more of the Mental Health Moment continues on 1160 AM. KBDT News Talk Sports. I want to thank Dr. Rebecca Good. Thank you for being on the show today.
I loved it.
Yeah.
See you tomorrow.
Lisa, don't hang up. So,
That was great. Lisa, don't hang up.
Lisa, are you still there? Okay, that laugh says yes, she's still here. I'm very, very serious. There's so much great information that is the future, the research and the projects that you're lining up. We definitely need you to come back, and when you are ready, that you want to talk about that outcomes database, and is that going to need to be reinvented, or are you going to do that in collaboration with another organization? There's a lot to share about that.
There is. I hope to do it. I hope to do it in several ways, Patty. One of which is that there was a lot of, unfortunately, it wasn't handled well, but there was an attempt made to document the treatment practices in the many outstanding treatment centers around the country. And because it was not handled well, there were some hurt feelings and some mistrust developed. But I hope to resuscitate that this year, where we will work with the residential treatment facilities to document outcome and aggregate their outcome experiences and measure their practices and what the success rates are on a confidential basis. But I also hope to partner with the American Psychological Association, who have invited us to create a subset of their overall outcomes database, which is really useful because there's so many comorbidities. The coexistence of anxiety and depression with eating disorders, for example. And if you had all of the data aggregated, the bigger the data pool, the more pinpointing the data can be. The other thing is, though, the third leg of that stool is that there are so many really significant population groups by demographic that are not being treated, and they're not being studied. They're not being included in the research profiles, the patient profiles of the researchers. For example, blacks are woefully underrepresented for a lot of reasons that would be a talk show unto itself to get into. But I hope that we will significantly impact the propensity of academic researchers studying in this field to include minority subjects to make sure that they have a diverse pool of individuals that they're looking at.
Elissa, so for the many people and their families out there who are suffering from some type of eating disorder right now, where do these people go for help?
You know, AED has an increasingly diverse set of publications and webinars and all kinds of materials that not all of them are, but most of them are available to the public through our website at no charge. We're not publishing to make money from our publishing. We're publishing to provide information. And we are a very big fan of and very supportive of organizations like FEAST, NEDA, the National Eating Disorder Association, ANAD, is doing great work around anorexia. What we desperately need as a community, and you know it, Steve, as well as I do, perhaps better, we need to have a stronger harmonization of our efforts, a stronger but right now, if you need help, there are a lot of places of the Alliance. Please don't let me leave out the Alliance. Our wonderful Joanna Kendall, who was named our Meehan Hartley advocate, strong spokesman and supporter of the eating disorder world. out of Florida, the Alliance.
And Lisa, do you want to
So-
give your website address so that people who are looking for information, they'll know where to find you?
Yes, ma'am. It's www, of course, .aedweb, that's aedweb.org. If you just type in AED, you're going to get automatic defibrillator.
Yeah, I don't remember, but it's not you.
Yeah. So you need to put that web in, aedweb.org.
Elissa, and finally, I was going to ask a very controversial question because I really don't ever ask those at all.
Oh, never.
And I do not have
Get
a
ready.
reputation for that.
Not a bit.
Get ready, drum roll.
But instead, just what advice would you give to the sons and daughters and moms and dads who are struggling with this right now?
Steve, really, from my heart, this is a terrible disease, but it is curable. People recover from it. You can recover from an eating disorder. It's frightening, but there is a worldwide community of people there to hold your hand, elbow bump, hold your hand, figuratively speaking, and know that there is nobody to blame. It isn't a question of pointing fingers or blaming. It's as I said, we know more, and the more and more we know about the connection between the human biome and between the genetics and the physical makeup of people and the society that we live in. It's a very complex equation. But I once took a trip from Las Vegas to Los Angeles in a car across the desert. And I was in the most remote part of the desert going up a mountain, and I thought, I'm hopelessly lost. And I saw a sign that said, "Don't despair, you're almost there, Tecumseh." And so I don't know where, Tecumseh is a little ghost town up in the mountains, but I never forgot that. Don't despair, you're almost there. Hang in there. Recognize, one thing I will say to families that's important to say is that you do have a role in this, regardless of the age of your child, and you want to fight to have have an engaged role. Excuse me. You don't want to turn your loved one entirely over to the medical system. You want to know that you have a right to know how they're being treated. You have a right to know how they're progressing, and you have a very important role to play in helping them recover.
Lisa, that's a great piece of advice and a great way for us to end this. There is hope. You're almost there, and we do invite you to come back when you are ready to talk about your next research program.
You're so kind to have me, Patty. I think you guys are spectacular. Thank you for the great work that you all are doing out there, and it's a great honor to be on the program today with you. Thank you.
We love you, girl. Thanks so much. Have a good one.
Love you too, honey. Bye.
Bye.
God bless you guys. Thanks very much for joining us on JP, Kathy, and the crew, and we will see you another time. Take good care. Bye-bye.